In the face of NHS budget cuts, trusts need to find ways of doing more for less to release vital cost savings while improving patient care. Sherwood Forest Hospital's NHS Foundation Trust has deployed Vocera communication system to allow hospital staff to immediately speak to the person or resource they need. By eliminating time wasted on bleeps and callbacks, the Trust is streamlining workflow and saving money.
Yeah, the drivers for Sherwood Forest Hospital's Foundation Trust to find more efficient working is really linked to our overall focus to provide the best patient care we can for our patients. And I think driving out the waste in our systems and making ourselves more efficient, more clinically effective is key to that delivery. Vocera fits into this strategy as part of driving efficiency because it picks up the whole area of wasted time. It communicates quickly between people, enables tasks and processes to be actioned much more quickly than they would have done without Vocera.
Vocera is a point-to-point, person-to-person or person-to-group communication tool that allows you to contact somebody wherever they are on the campus, and you don't need to know where they are in an instant, basically in a few seconds. So it's enabled us to achieve targets where communications in certain departments was a serious issue and causing delays. Theatres, for example, was one of those.
Some of the challenges we experienced before we introduced Vocera was our paging system was very slow. It was less efficient for us because it took us 40 minutes to get a response from a doctor if we got a response at all. And now with Vocera it takes 2 seconds, if that.
Call Ward 12 nurse.
Sarah Burton.
And we get an instant response and an instant two-way conversation, and actually being able to have that conversation allows us to change treatment quickly and be with the patient at the patient's bedside much more.
The challenges before Vocera was introduced in this trust, I'll just give one example. In my role I had to collect a surgical wide bed state that took me anything between 45 minutes and an hour in the morning. Because of clinical activity, no one could get to the telephone. Whereas Vocera now, it's instant. I get the nurse in charge, probably 4 or 5 minutes, and I've got a bed state.
The key workplace target that has been influenced by Vocera is the 98% 4-hour wait in A&E. It's a time-critical target. By the time the patient's been admitted into the department, the clock is already ticking, and making sure that they're cared for properly and then moved into an appropriate setting is really very time critical, and Vocera just does break down those barriers between people in terms of making sure people know where patients are, where they're going, what they're going to happen to them, and it has improved things hugely.
The impact of Vocera on the workflow within our unit is that we're more efficient, we're quicker, we spend more time with our patients, we can get them discharged home quicker, we can get them into beds quicker. So therefore, if we do things in a timely manner, it allows the patients to have a good pathway of care and it lets them go home quicker.
It's enabled me to be accessible, you know, all the time. People can get me instantly, can ask for advice. I can respond to any incidents, any issues in the clinical areas more quickly.
One of the other powers and benefits of Vocera is it's not just a communication system, point-to-point voice. It has the ability to link to other systems like telecoms and email and messaging. We have gone down the road with the messaging and linked it into messaging so that we send alerts to the Vocera badge for things such as hospital-acquired infections.
If we get a patient in A&E with MRSA status, I can instantly Vocera the ward. You know, if there's no cubicle available, they can do a bit of shuffling with patients and enable a cubicle to be there. So we can move the patient directly from the accident emergency department directly to the ward. So it reduces clinical risk basically for others and for that patient.
But there are lots of other measurable benefits as part of Vocera's implementation. In particular, where we want to get patients seen quickly for cancer patients, we use that to alert the specialist nurses that patients have been admitted into hospital, and this generally means they will have a shorter stay in hospital, even turnaround on the day. So clearly better for patient care, more efficient performance in terms of our cancer targets. In terms of Vocera's future, in this trust. I mean, we see that we're still only scratching the surface in terms of its implementation. The whole messaging, dictation facilities that are there with the software, the ability to broadcast to groups, we still don't really make a full use of those, but we can see certainly that those are opportunities that we will be taking up.
The Vocera communication system is deployed in over 600 hospitals worldwide, with over 450,000 users each day. With Vocera, hospitals have increased operational and staff efficiency, including increased operating theatre efficiency and throughput by reducing start time delays from 67% to 6%, reduced patient bed assignment and placement time from 6 hours to 2 hours, a $1 million reduction in staff overtime. Intelligent, immediate communication with key resources saves time and money and improves patient safety and satisfaction.